Good Health is sponsored by Sullivan County Community Hospital.
Welcome back. Joining me now is Holly Clevenger from Turning Leaf Behavioral Center at Sullivan County Community Hospital. Welcome this afternoon.
Thank you.
So first of all, for people who don't know, tell us exactly what Turning Leaf Behavioral Center is.
Well, we are a mental health organization. We're outpatient, and we are geared towards seniors age 65 and older, although we do have some people that are in their 50s that are eligible for our program. And we address issues such as anxiety, depression, grief and loss issues, and just life transitions in general in the senior population.
Yeah, you know, I'm sure that there are a lot of life changes people don't even think about when it comes to being a senior citizen.
Yes, I mean, there have been increased levels of anxiety, of course, due to them being in that vulnerable population that is at high risk. So we've seen some increased levels of anxiety and depression and just increased fear that goes along with that.
Well, no doubt. And how does COVID-19 then impact the services that you are able to provide?
We usually do groups, but because of people not being together in larger crowds, we have started doing individual therapy sessions. If a patient is comfortable coming in to the office one at a time, I will see them individually, and we also offer telehealth services for those who have access to that.
And so what are some of the coping skills that you're giving to seniors to kind of help them get through this period? I know a lot of them probably isolated.
They do. I really encourage them to stay in touch with loved ones, you know, whether it's through telehealth or just through phone calls. I encourage them on nice days as the weather warms up to get out and, you know, maybe take a walk, even just sitting in the sun to get that vitamin D just to help improve their mood. And for those that are faith-based, I encourage them to really rely on their faith and use that as a support and a strength during these challenging times. I also encourage them to maybe limit the amount of media exposure that they have, because watching the news just on an endless loop can increase feelings of anxiety and fear.
And what are the results that you've seen with this program?
We have seen people come into our program that initially weren't too sure about group therapy, but once they got into it, they really loved it, and they surprised themselves by how much they were willing to share and the camaraderie that they felt with their peers, and just feeling that others could relate to them and understand what they were going through. So we have seen very good results with this program. We've seen some people graduate and just seen increased coping abilities to cope with the life transitions that they're going through, the grief and loss issues, as well as, you know, being able to better manage feelings of anxiety and depression.
So Holly, tell me a little bit about how does a senior with increased stress during this time who wants to get involved in this program go about doing that?
Well, I would encourage them to reach out to us. They can call our direct line at 812-268-2562. Or if they have computer access, they can also go to our website, www.schosp.com. And we would encourage anyone who is experiencing increased stress to please reach out to us and give us a call.
All right, Holly, thank you so much for joining us.
Thank you.
Stay well.